So recently, an effort to create single-payer healthcare in New York has effectively been killed. The New York Health Act, which would, again, establish a single-payer healthcare system for the state of New York, will not receive a vote in the state legislature. Not only were insurance companies there to lobby against it and effectively to kill the bill, they also teamed up with union leaders to do that as well. Quote, the MLC's, Municipal Labor Committees, argument against the bill is that unions have sacrificed wage increases in the past in order to bargain for better health care coverage and lower costs, and forcing them to switch to a single-payer system would make that past work a waste, the Daily Poster explains. However, several union leaders in the past have spoken out in support of Medicare for All, including Service Employees International Union President Mary Kay Henry, saying, I really resent the 16 million workers who joined together and bargained for better health plans being pitted against millions of Americans struggling to get healthcare coverage, effectively scoffing at arguments that had been floated that implied that Medicare for All would hurt union workers who have fought hard for their healthcare plans. Yeah, we'll just conveniently ignore this fact right here. But even given that, there's still several union workers and leaders out there who do have a certain hesitancy with Medicare for All because of the good benefits that they have fought for in the past. Most notable is the Culinary Workers Union in Nevada, who fought hard for their health insurance plan, which had them pay significantly less than the average, and they don't want all that hard work to go to waste, they say. However, there have been studies conducted on this, and it has shown that Medicare for All would actually help the labor market. As economist Josh Bivens finds, due to employers no longer having to spend on providing health insurance to their employees, wages and salaries for them can increase because these companies can spend more on paying their workers better. Not only that, but it incentivizes employment by incentivizing people to get a job because there's no longer the threat of them potentially losing their job at a moment's notice and affect their health care. And that is definitely something that has become more and more prevalent with the economic impacts of the COVID-19 pandemic. And not only that, but increases self-employment because it requires people who are considering starting a small business to not spend on health insurance for their employees. So it actually allows them to spend better, if not less. And even given all this, knowing this, there is a lot of union support for Medicare for All, most notably National Nurses United, which is the largest nurse union in America. And in fact, a representative for the union says there is widespread and unprecedented support from unions for Medicare for All. In fact, unions representing a majority of union workers in the United States, over 9 million workers, have endorsed these bills. We are at historic levels of labor support for the legislation, a fact of which we are extremely proud. In addressing the argument about how this essentially makes all the union workers' work in fighting for their health benefits go to waste, well, it actually makes it easier for unions in the future. We all know how many corporations like to spend money union busting. We saw that with Amazon earlier this year with the Bessemer, Alabama union effort. And overall, employers generally, almost half the time, interfere, illegally might I add, in union election campaigns. Now, the solution to this also is to pass the PRO Act, which is currently stalled in the Senate. That would make it easier to join a union. However, providing Medicare for All would make unions a lot less likely to go through all the trouble of organizing when many of them know that the struggle to actually form a union and to succeed is difficult. Now, this isn't me saying I do not support unions. I absolutely do. But knowing how difficult it is, Medicare for All would definitely lessen the need to unionize, which we all know is incredibly difficult given the wealth and the propaganda tactics and the scare tactics of these corporations. Thank you all so much for watching. If you enjoyed it, do the usual, like, comment, subscribe. If you want to see some more video essays I did, you can check them out right over here. Otherwise, there is my last video right over there. What do you guys think of this? All right. I'll see y'all later.